Hello viewers, I am Dr. Shailesh, Senior Consultant at Shekar Eye Hospital, JP Nagar, Bangalore. Today I will be speaking on a very interesting topic called maintenance of eye health. See, we all have beautiful eyes and the world is beautiful. We have to maintain it lifelong to see this beautiful world without much of hassles. So how do you maintain this eye health? See, I would like to classify them based on the age group, like a child, young individuals, middle-aged persons and elderly. How do you recognize any problem in a child? So child usually will not complain anything unless the child keeps rubbing the eyes or there is be watering and all. So we have to assess if there is any discharge from the eyes, the eye becoming red, or unknowingly the child will be playing and hitting their nails or fingers and causing some trauma to the eyes. So we have to carefully assess and show to a eye doctor immediately. In children we should not neglect. That is one part. Second part is children tend to have this watering constantly and small discharge. So they will have a NLD block, that is nasolacrimal duct coming from nose to the eyes will be there. That needs a gentle massage to allow the fluid to pass through the duct. So that small tip one has to do, so to improve the circulation of the liquid from the eye to the nose. So that is called NLD blockage and that to be treated. I have to consult the eye doctor. The other issues that a child can have is, one more thing is that you should not allow a child to put any cosmetics, or you should not apply any kajals or any creams very close to the eye. They all cause some chemical allergies and injuries. So avoid those things. Now in children specifically, from third year onwards, they start reading ABCD kind of a thing. So you should get their eyes checked for any refractive error is there or not. Second part, children tend to have some corneal opacities, or even they tend to have glaucoma and cataract. Not in all, in some of them. So anytime you see a white opacity or the child is searching for any objects, they tend to trip, frequently fall when the area is clear. That means there is some vision problem in the child. So you have to get the eyes checked and corrected properly. So the very important part of any child is that they tend to have refractive error. The glasses like myopia, hypermetropia, they tend to have refractive error during third year, fourth year onwards. And they also tend to have squint, that is the misalignment of eye. The eye sometimes goes outward or sometimes go inward, on and off. So those things should be recognized early, and a refractive error after putting drops we usually do it, and a proper checkup of the eye has to be done. So if there is any refractive error, we will give glasses, corrective glasses, so that the child sees better. Otherwise, unknowingly a child will be losing out on the grades in the school. The performance will be coming down because of the refractive error. They can't see the board clearly. They can't see what the teacher writes on the board. So they won't show interest on the activity around us. So their performance in school comes down. So we have to get their eyes checked, and then regular follow-up with the eye doctor is important. Now, how do you prevent all these things? Like, one is the checkup and corrective glasses to be put, so that they don't develop any laziness in future, amblyopia, they maintain the good vision lifelong. Second part is exposure to sunlight. Children nowadays are all stuck to the four walls in the house. So we should encourage them to go outside, exposed to sun for 1 or 2 hours in a day minimum, so that the hormonal changes helps in the improvement of the eyesight. So we should not allow the children to stick to the four walls. Let them go out, play in the sun, and they should not get glued to the TV, mobile or any gadgets. So frequently discourage them from doing all those things. So let them play with friends, let them play in sunlight, and have a frequent eye checkup, so that update the number, and then so that their eyes may be maintained with a proper eyesight in the childhood days. Now the next part is the younger individuals. So younger individuals are very, very dynamic, and they keep moving out. They are prone for accidents, trauma. They keep fighting also at times. So be careful, and they also are very active in sports. So whenever they play contact sports like shuttle, badminton, racket and all, there will be injury to the eyes with the shuttlecocks and all. We see a lot of young individuals losing eyesight or having trauma. So wear a polycarbonate protective glasses when they go out for playing such contact sports. That is one thing. Second thing is, any injuries, please report to the eye doctor without delay. The third is that a lot of younger generation use contact lens, the cosmetic contact lens. So be careful that whenever you want to buy a contact lens, buy it from a proper authorized personnel, a good quality contact lens and should not be used for a longer duration. Otherwise they damage the eye cornea, they cause infection, sometimes they cause corneal melting, and very disastrous consequences can happen. So be careful while selecting any type of contact lens or any cosmetic type of contact lens. Again, same thing holds good. Cosmetics, those who apply, be careful, don't share cosmetics, use your own and a good quality cosmetics. And be careful while driving, and when you drive two-wheelers and all, wear helmets, because many accidents happen when they don't wear helmets. So the injury around the eyes can happen, they cause traumatic optic neuropathies, they cause permanent loss of eyesight in individuals. So enjoy your young life, but with caution, like wear helmets, take adequate precaution while playing sports, use proper glasses and contact lens when you are outdoor, when you want to have any functions and party. That is the younger part. Now comes to the middle age group. So in middle age group at around 40s or so they tend to develop presbyopia, that is reading glasses. They will not be aware that they have some problem, they feel the eye headache or the eyebrow pain and all those things. So these things is because they are not able to read clearly. So they will be constantly struggling, and they will be moving the object far away, or they will go to the proper lighting. So without realizing that they have problem, they have to wear glasses. They have presbyopic glasses. Once you wear glasses, the focusing will be very good, the images are sharper, you don't have fatigue, you can work better, you can read for a longer duration, and the eye health will be maintained. And those ages you have to check your blood and see that you have any BP, blood sugar, cholesterol, or any thyroid eye diseases. Thank you for watching this video, and please like this video and subscribe to our YouTube channel at shakereyehospital.com. Thank you.